Hello, I'm Jeremy Fernandez, and this is our weekly live stream to answer your questions about the COVID-19 pandemic. So feel free to leave your questions in the comments sections below, and we'll get to as many of those questions as possible. Now, joining us to answer your questions this week is Professor Tony Blakely, an epidemiologist and statistics expert at the University of Melbourne's School of Population and Global Health, plus our national medical reporter, Sophie Scott. Welcome to both of you.
Thank you.
Let's get straight into it. Professor Blakely, we've always been told that outbreaks were expected to occur from time to time. Someone who wrote into us asked this question. Now that we're seeing these record numbers in Victoria and high numbers day after day, how alarmed should we be?
Okay, so we're in the middle of quite a sizable outbreak here. You might even call it a second wave. The concern here is once we get on top of this, will it just keep coming back again and again? Well, the possibility is yes, that might happen if we don't get rid of the virus completely and there's still community transmission. And when we open up, the outbreaks will recur. That's a possible scenario. Also, though, a game changer here is potentially masks. So if we're all wearing masks, we may actually, in the future, once community transmission's low, actually keep it at bay and not have too many big outbreaks going forward. The final thing is, and we finally got clarity today from Prime Minister Morrison, that we are all, that is all states and territories, aiming to eliminate community transmission. If Victoria gets to that point, then there won't be any more outbreaks unless there's an incursion through quarantine. So that's what I think it could look like.
All right, I do want to come back to this question of elimination versus suppression. This has been a big issue week to week, and it certainly puts all the states and territories on different paths at this particular point in time. Let's come back to the situation in Victoria. Why is it that we're seeing such high numbers day after day, even though it's been about a couple of weeks now since we started seeing those restrictive measures coming back in?
Okay, so my theory is as follows, and I think it's been borne out by the data in the last week. We had the first epidemic, if you like, in the first 12 postcodes, and that's probably come down a bit. Then we had the rest of Melbourne going in, it came up like this. And then we've had the essential workers like this. And by the time you join those three curves that we don't see separately, you end up with a hump mountain. You're going up the tabletop, and then you're on a long plateau, because those things are occurring in series. That's why the numbers have stayed up. So the position we've got at the moment is that the essential workers, unfortunately, are propagating the outbreak at the moment. I say unfortunately because we want them out there. They're part of our economy. The building or construction industry, part of the economic stimulus of the government is through construction, and these guys are out moving through the economy, but unfortunately also transmitting the virus. So I think that's what's happened, and we can talk more about some of the measures to try and deal with that without shutting down the essential worker industry.
Sophie, I'll come to you at this point because New South Wales is, I suppose, seeing very early stages of at least one of those curves. Where are we at this point in time in New South Wales?
Look, I think we are looking at what's happened in Victoria and just hoping and praying that we don't follow what's going on there. So I think the government here has certainly been in New South Wales probably a bit more proactive than others to sort of, we don't want to follow the path of Victoria. And Gladys Berejiklian has said, particularly this weekend, for people to rethink socialising, to rethink non-essential travel. So while they haven't mandated those things, they're really suggesting that people think very carefully about the choices that they make in New South Wales. Professor Blakely was talking about essential workers, and certainly what we've seen in Victoria, which is a concern, and we saw it in New South Wales as well, is the issue of aged care. And there's a number of nursing homes and aged care places in Victoria that are now affected. And there are those essential workers that are going to work in aged care that are potentially transmitting the virus from one aged care centre to another. And many of them are casual workers, and they work in a number of different facilities. And so that's been identified as a key area of concern, both in Victoria and also by National Cabinet today, to make sure that Victoria doesn't see the repeat of what happened in New South Wales with the couple of aged care nursing homes where we had a lot of fatalities and an absolute tragedy for those families. And that's what we don't want to see happen in Victoria. But unfortunately, the figures today with the number of deaths and being in older people and people in their 80s and 90s in nursing homes, we're starting to see that. So that's a real concern. That's a real pivot point. And that's a real red flag that the National Cabinet's identified. And today they've effectively said to the states today, which is interesting, we want more information. So, while the states have been very good at having press conferences every day and giving out as much information as they can, it's clear from that the meeting with the press conference today with Scott Morrison that they want more information too about what's going on with aged care, with intensive care, with contact tracing, to find out if there are lags happening and what can be done about it, because there is obviously a couple of things that are still breaking down in the system.
Professor Blakely, you've done a lot of modelling on this, haven't you? What's your outlook for aged care in particular?
I haven't done aged care, but I want to jump in on some things that Sophie said that I think are really important. First one, she talked about those essential workers going between the rest homes. We need to do this smarter. So imagine we had a crew of 6 people in a cleaning gang and they went to 3 rest homes each day. Boom, boom, boom. That's nuts, because they're going to transfer it between. So we take those people and we say, work as a 2-person cleaning gang and only go to 1 rest home. So there's some really sensible stuff. The second thing that Sophie said that I thought needs reinforcement is the data. So in Victoria, we're starting to get policy or the daily strategies informed by the data, for example, the essential workers. And I'm delighted to hear that the feds want to see more of that data too. So I think those points need reinforcement. I think Sophie's right to bring them up.
In terms of the essential workers that you speak of, Professor, what are better ways to manage that, given that, you know, this is very much an economic issue at a macro level, from house to house, as well as the whole economy? I mean, we're talking about 40 years worth of paying off these debts that we're accruing right now. How do you manage that from an economic point of view and make sure it doesn't cause more disruption than it needs to?
Well, that's what we're going to be working on hard next week, and I'm sure there are people in the Doherty Institute working on it too. Let's go through the scenarios. All right, we want to get on top of this virus without killing the economy. One way is to go into sounds bizarre, but go into a harder lockdown now and really drive that virus down to its eliminating community transmission. But that would have a major economic impact now, but might get us to a better place. The government has clearly said today that they're not going to do the harder lockdown. So what else can we do? Well, things that we can do is the mask wearing could be the game changer here, because if all essential workers wear them and wear them well, so when they go into their construction site and they're behind the gate and you can't see them, they just don't take it off, they leave it on, that may be enough to start breaking those chains of transmission. There may be, and this is where Premier Andrews on Sunday said he's going for a line by line by line review of all the essential workers. There may be some industries where it's particularly bad and they just need to be shut down for a couple of weeks to take the dampener off. And I thought that's what we would hear on Monday or Tuesday, but we didn't, and said we've got other policies, which is fine because I haven't seen the data. So basically we've got to be really nimble, make good use of that data coming in, and change our policy settings as quickly as we can, because we don't want to kill the economy. And that's why I think Sophie's point, and I didn't hear it today, that the Fed's Prime Minister are calling for more data to go up there as well so they can look at, I think more data sharing right now is good.
Sophie, you were monitoring that National Cabinet. This issue of suppression versus elimination came up. What did you learn?
Well, we did hear, I mean, I can't recall the exact words that the Prime Minister was saying in terms of whether he actually used the word elimination versus suppression. There has been a change in the language, and I think it was one of the deputy medical officers that used the word. I think it was aggressive suppression or radical suppression, or some slight change to the language, which seemed to suggest that they were moving more towards elimination. I mean, one of the big factors in the debate that isn't often drawn out when you're talking about the elimination versus suppression, and I'd be interested in hearing Professor Blakely's view, is if you go for elimination, which is great in theory, but how can that continue once we open our borders up? And that's one thing that I think we don't often consider. So if we have no virus circulating in Australia, like they do in New Zealand, there's virtually no virus circulating there, how do we maintain that once we open borders up from around Australia and also around the world? Because that would then be a risk, obviously, if people were bringing it back into the country. So how can we, I'm interested in Professor Blakely, asking him, how can we maintain that strategy, but at the same time have some opening of borders, which obviously people would want in the long term?
I'm very pleased to jump in here. Thanks, Sophie. So I'm going to talk about 3 things. I'm going to talk about the wording from the Prime Minister today, and then about the definitional issues, which I think we can largely then throw behind us because I think we're done with that after today, and then the how-to, which is what Sophie was getting to. I have the wording from the Prime Minister. I'm going to read it to you because it's really interesting. He said, A couple of other points that were agreed on today was an affirmation of the suppression strategy. So he's basically saying we're still doing suppression, but listen on, that we've been working to nationally now for many, many months from the outset. Listen to this though, next sentence. The goal of that is obviously and has always been no community transmission, which is what we have been defining as elimination for some time. So let's get to definitional issues now, the second point. When I say elimination, I mean no community transmission. That is those cases that pop up somewhere, and you can't find the source. So that means the virus is endemic somewhere in your community. It does not mean no cases in quarantine where people are at the border for 14 days in quarantine. That is not what we're talking about. So this is really good news. It appears, and I think Scott Morrison has moved his position on this, but he's making it look like he hasn't, is that they have a goal which is the same as the elimination goal. No community transmission. Excellent. The key issue now is how do we do that, which is the third point in Sophie's question. So, Sophie, to come back first, it doesn't mean closing the borders. It means really good quarantine at the borders. But we know that quarantine is not always perfect. We should be getting better at it.
And hopefully there'll be some good lessons to learn from what happened in Victoria to make sure that doesn't happen again.
I completely agree. But look, it's not rocket science. People are in there for 2 weeks. You don't let them mix with the other inmates, to use a prison analogy just for a bit of humour. I'm not trying to say it's like a prison, because you don't want people at the end of their quarantine to be mixing with people who've just come in that might be infective. So you've got to keep people separate, and then you let them out after 2 weeks, and you do some testing at the beginning and at the end to give you extra confidence. And if they don't want to be tested towards the end, you extend the quarantine from 14 to 21 days, and there's 0.0001% of people would still be infective 21 days later, so it's minimal. So that's the first step, good quarantine. But, and this tinderbox analogy has been used quite a bit recently. Think about WA. They're back in the sports stadiums with 30,000 people in there. If a virus got in there, it would just go kaboom. So you would have heard Paul Kelly and others in the last 10 days saying, please, 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 WA, citizens, keep your physical distance just in case. So you still need to be behaving in COVID-safe manner. And the final thing, and this is mission critical, and this is another mistake we made, well, something that didn't work in Victoria. The community contact tracing, testing, and surveillance systems are critical, because if a case does sneak through somehow, you need to be able to stamp it out so quickly. There's a great paper just published in one of the top journals today where they actually analyse how you do that really well and get that effective rate less than 1, so that if something happens, you drive it down. That strategy was our strategy in Victoria, that we built up that capacity in the first lockdown, ready to jump on an outbreak if it happened, and it failed because we lost control. So we need to do that better. I think New South Wales is doing it better than us. But so learning as much as we can to do that better. So 3 things. 1, quarantine has to be done really well, and you can still have international visitors coming in. 2, the population still needs to be behaving in a COVID-safe manner. That may not mean wearing masks all the time, but you want masks ready to go within 24 hours if a case got in, but you'd be keeping physical distance, hand washing, all that sort of stuff. And 3, your public health workforce has to be on standby the whole time, ready to jump like crazy if a case gets in.
Professor, that does sound like a heightened sort of alert level ongoingly for a long period of time. And we're seeing with the rollout of this sort of second wave that people are sort of really kind of sick of this lifestyle. Do you see an end to that, even with elimination?
Well, I didn't say lockdown in my 3. So we'd still be out and moving around. The cafes would be back to somewhat near normal. We'd still have people like me who are academics perhaps going into work 1 or 2 days a week but working home. It's going to be a lot better than what we're doing now, which, I think that's okay. And then it is until such time as we get a vaccine, or if that strategy fails, because there's a chance we may not get a vaccine, we will need to deal with the virus in other ways, which I can speak about if you want me to.
Sophie, I will come to you about this question on masks, because week after week we get a lot of questions, people asking about masks. And this week a number of people have said, it feels really uncomfortable to breathe through a mask. Some people are asthmatics and they find it sort of suppresses their breathing even more. What are your thoughts around that? And do you have any particular tips on how people can become accustomed to this new way of living, particularly in areas where physical distancing is difficult to do?
Yeah, so there are a couple of points there, Jeremy. So the advice is for the Victorian Health Department, where obviously in Melbourne and other places now masks are mandatory, that if you have a medical condition such as asthma, you actually don't have to wear a mask. So I double-checked that this morning before we came on air. So I know we've had questions from people who say, my children are asthmatic, they can't wear a mask without coughing. So in that instance, then they don't have to wear one. For the rest of us, wearing a mask we're not used to it. We don't have a culture like in some Asian countries where people are very comfortable wearing masks. You see them all the time, and you have for many, many years. It's a new phenomenon for us. So I think accepting that it's going to feel a little bit uncomfortable is probably a good first step. It's not going to feel natural. We're not used to wearing them, but that doesn't mean we can't get used to wearing them. What can often help, because, if some people feel like they can't breathe properly, you can use to try to breathe through your nose a bit more rather than breathing through your mouth, using that nasal breathing and trying to breathe a bit more deeply into your diaphragm rather than just focus on that shallow chest breathing that can make you feel a bit more anxious anyway. So I think that's the first step, recognising that, yes, look, we're not used to wearing masks. It's going to feel a bit weird, but we need to do it. We need to get used to it. The recommendations are really for face coverings, and that's the WHO recommendation, is for a face covering rather than a mask. And so that's why they're recommending those face coverings that have the couple of different layers of fabric. And they could be quite soft. They don't have to be a sort of sturdy and firm material, and they can often be a little bit more comfortable than the surgical masks. And certainly we're seeing a lot of online sellers, and people have started making those fabric masks. And they're pretty easy to get. You just need to make sure that there are a couple of different layers of the mask, so it's going to be effective. And then taking it on, putting it on and taking it off in a safe way, washing your hands, making sure you're not just putting it on a surface and that sort of thing. But I think accepting that, the research shows that even if 70% of us wear masks, it's going to make a big difference to reducing the spread. And so the more of us that can get on board, even as uncomfortable and awkward as it might appear, it's going to make a big difference.
Professor, you're a major proponent of mask wearing. Why has it been so wishy-washy, kind of making it mandatory? Helen on Facebook has written in saying, why just not make masks mandatory from the start and just cut out the potential for an explosion in the number of cases?
Well, it is now mandatory in Victoria. So the question is, why didn't we do it sooner? Well, in the early parts of the pandemic, nobody had really done a systematic. That's where you systematically summarise all the evidence review. And that came out about 3 weeks ago in The Lancet, the big journal. And that showed about an 85% reduction in transmission from wearing masks. Amazing. It may not be quite that good, because it might be in those studies a bit of bias where people who were more health conscious wore a mask and those who didn't. Nevertheless, 2/3 or so, that's fantastic. So that, if everybody's wearing them, we'll just cut the chains of transmission and could well see the tipping point for us. I was going to throw in, when Sophie was talking about it, she's saying it's uncomfortable, you get used to it, all that stuff. Well, I've been out on my verge here yesterday for camera crew, and then I actually went out today to go and get something from the supermarket. And in my excursions, everybody was wearing a mask. It's all of a sudden, and overnight, it's become the cultural norm. The only people I did not see wearing a mask was a runner who was running quite hard by himself if nobody else around him. That's not really a problem. And the other person I saw was somebody who was taking a smoke while he's out walking, which I don't condone. But so the culture's changing rapidly.
It is changing rapidly, and I want to tackle that question of runners, Sophie, because someone did write into us and asking if runners and joggers pose a greater risk to the people around them than a regular walker. And we've heard all about sort of the aerosolised breath and how far that breath goes. Should people be avoiding running?
Well, we've seen that research, and I think I don't know if the people have seen, but they've done sort of examples of what happens when people are running and the respiratory droplets that are sort of coming out of the jogger, and it's frankly not a very pleasant sight. It sort of would put me off running or walking next to any joggers, that's for sure. So in Victoria, they've said you don't need to wear a mask if you are running. But I have seen on social media that people who are runners have worn masks and said you actually can do it. It's just something you need to just sort of get used to. So if you are a runner and you can still wear a mask, probably for the rest of us, I would probably try to avoid being next to someone who was running and, huffing and puffing and, all the droplets going everywhere. It's probably just better to be on the safe side and try to keep your distance. Again, the physical distancing is so important, because even if you do see someone running, if you do keep that distance that we're supposed to keep, then you're not likely to come close enough to them that they could actually sneeze or cough or huff or puff on top of you. But I've really sensed, I'm in New South Wales, but I've sensed that change in the last 24, 48 hours in Victoria, that so many people are wearing masks. And I sense that it's going to be happening in New South Wales as well. I get that sense that people are moving towards that, and I think that's a good thing. I think it's a mindset thing as much as anything else, and I'm really relieved to see that so many people have taken up that call in Victoria. And I hope that if we do have to wear masks in New South Wales, that people do the same thing, because the research, like Professor Blakely says, we now know and we're learning more and more that masks can make such a big difference. Early on in the pandemic, there was a real concern about the adequate supply of personal protective equipment, and the authorities didn't want surgical masks being used by the public when there may not have been enough for people who really needed them. That's not an issue now. So that's why I think also they've been more likely to say it's fine to have a mask, and in some cases you have to have a mask.
I want to go to a question from Gabby Esther, who's written to us via Facebook, Professor, asking if you think there'll be a third peak of this virus in Victoria. She's looking well ahead, and not without good reason.
Well, that all depends. It's a crystal ball, this one. If we didn't eliminate the virus and we got it down to low levels of community transmission, and then we all came out, went to the pub, partied, started hugging everybody again, then there would definitely be another peak. All right? So it certainly could happen, and it would happen if we did that sort of stuff. If we eliminate the virus and we protect our borders with quarantine, then there won't be another peak because there's no virus. In between those two is a whole lot of possible scenarios of small little outbreaks or maybe a couple of kicks here and there. And how that plays out is, at one level, very chance. This virus is stochastic. So it can play out in my models that we run. One run to the next, it can behave quite differently. And think about it, a super spreader. These are the people who give it to 10 or 20 people. If the first person in that comes break through quarantine, or the first person they give it to is a super spreader, it can suddenly jump up quite quickly. Now, whether or not it turns into another wave will depend on whether we're all wearing masks, whether our contact tracing and surveillance systems are good enough to squash down that outbreak. So, I forgot who the name of the person was, to the person, it all depends. It's very much possible, particularly if we start behaving badly and we leave the virus in here, but also if we eliminate it, it wouldn't happen. And in between, well, it all depends.
That question was from Gabby Esther. So, Gabby, thank you for writing us with that question. We've also had a number of questions, Professor, about asymptomatic people, pre-symptomatic people, and what risk they pose to the broader community. And some asking, shouldn't we just test everyone just to make sure that you don't have these kind of zombies walking around carrying the virus unknowingly? How great a threat is that?
All right, let's do some facts first. We don't actually know exactly the situation, but run something like this. About a third, 20% to 50%, you see it's quite right, and it varies by age, of people who get this virus are asymptomatic. Now, they're still going to be infected for 10 odd days. They may not be as infective as the person who's symptomatic and coughing all over you, but because they don't know they're symptomatic, they're still out there moving around, so they end up infecting as many people. And that's why this virus has been so clever at spreading. So a third, roughly, people are asymptomatic. Then all the people who become symptomatic and then isolate because they're symptomatic, they're going to be infected for 1 or 2 days before they become symptomatic. So that's another way that the virus transfers. Now, the question was specifically about why don't we just test the hell out of the nation and find all these people? Well, you could do it. It would take a lot of resources, but you'd have to do it again and again and again. And when you're doing this, we've still only got, what have we got at the moment, about 500 cases a day in Victoria. So when you're testing for that, you're trying to find a needle in a haystack. And it's probably better to target your testing resources to those areas of high risk. Now, obviously, they go in descending order. People who are symptomatic, people who are contacts of people known to have COVID, people who are contacts of people who are symptomatic and might have COVID, people who live there, those with COVID. So there's when you throw a stone into a pool and you get the rings around it, there's the concentric rings around it that we'd want to put the testing into, because if we just tested in rural Victoria, say, we would be wasting our precious resources. So remember a few minutes ago we were talking about making your contact tracing and surveillance systems so much better. That includes using your testing capacity really, really well, because getting that test done very quickly and the result back very quickly can make quite a difference to how much control you have over outbreaks. So you have to focus those resources to some extent.
Sophie, what about getting tested for antibodies? A number of people have written to us asking whether they can get the test for antibodies, particularly those who are curious, asking this question, those who have no symptoms.
Well, there are a couple of tests that have been approved for antibodies, but they have been particularly unreliable and they're not recommended for general use. We also don't know, I mean, there's been, with the vaccine trials, the early vaccine trials, we've been able to look with those studies how long the antibodies lasted from the vaccines, but we don't know a lot about how long antibodies last once you've had COVID-19 and how long they last in your system. So I don't think the technology is there yet with those tests. Certainly they're not something that's recommended for people to be doing. I remember a little while ago there was this concept of like an immunity passport that you could say, oh, I'll have an antibody test to show I'm okay. Well, that's sort of really fallen out of favour because they quickly realised that it was pretty unreliable and not something that we don't have that technology. The science isn't there yet. It may be down the track, but it's certainly not there yet. So that's something that we have to just sort of, wait and see, and hopefully the more, I mean, the science and the movement of the science on this topic is phenomenal. I've never seen anything like it in terms of it actually makes it very difficult for academics, I imagine, like Professor Blakey, to stay across everything because there's so much research coming out every single day on so many different topics. But that's, on one hand, that's challenging, but on the other hand, it's exciting because it means that we're more likely to get the breakthroughs that we need much more quickly, because there's just so much money and so much effort being put into looking at these important issues like, better treatments, the vaccines, antibody tests, those sort of things. So I think the timeline for success in science has definitely been shortened with the amount of money and effort that's been putting into science. But with things like antibody tests, we're still a little way off.
Professor,
go ahead. On the antibody test, it's kind of like this classic individual versus population difference. At the individual level, it doesn't necessarily tell if you're infected because it's got imperfect sensitivity and specificity, we call it. But when you get up at the population level and you do a survey of 10,000 odd people, it'll give you quite an accurate prevalence in the population. So just as one example, there was a paper, again published in The Lancet, looking at Spain, showing that they had 6% of their population had been infected using antibody tests. So it's very useful information at that level, but at the individual level, it's not proving as useful as we might have hoped for things like immunity passports yet.
I want to come to a number of comments that I've read online over the course of the last few months, and a few discussions I've personally had with a number of people about, people saying that this is primarily a disease of the elderly, and that is what we're trying to manage. Professor Blakely, how useful do you think it is to look at the death rate as a measure of how widespread and how bad this virus is?
Okay, let's do some basic epi here. So this virus infects everybody. I'll come back to that. But as far as its consequences, they vary enormously by age. So a person in their 80s infected with the COVID virus might have at least a 15% chance of dying of it. But somebody infected in their 20s has a 0.001% chance. What that means, though, is that it creates a sense of immortality amongst young people because they don't think they're going to be affected much. And the reality is, at one level, that's true. But if they get infected, they can pass it on to their grandmother and they become part of the whole population spread problem. So this is a public good issue, is that even if you think you're bulletproof, you going out and behaving badly and getting infected is not good for the community. Now, the last thing I want to say, because this has been talked about a bit, is that young people are less likely, but they still do get very sick, and some of them still die. Moreover, some people are getting chronic conditions after this virus, like kidney disease or strokes and various other bits and pieces we don't all understand yet. So this is not a great virus to get if you don't need to get it. So I think that should be enough reason, if it's only a personal consideration young people have, to try and not get this virus, and certainly from a public good point of view, try not to behave in a way that get the virus helps protect everyone.
Sophie, you've been doing a lot of work, haven't you, investigating some of the sort of longer term health effects on those people who do get COVID-19 and go on to survive, but have all sorts of sort of health issues associated with that illness.
That's right. I mean, we did a story where we looked at the impact that this virus has on the inflammatory processes in the body, how it affects not only the lungs, but the heart and the brain, and people having strokes and heart inflammation and having symptoms that's, neurological symptoms. We spoke to one doctor in New York who said at least half of his patients are having ongoing neurological problems as a result of having the virus. In the UK, the NHS is setting up clinics for long-term rehabilitation for people who've had the virus. So it's certainly not something that most people will just, have it get better and then that's fine. It's quite unique and different, and that can be something that can impact young people as well. I think what we're seeing in Australia, though, is as we are seeing more community transmission, we're seeing more younger people being affected. And I think I'm hoping that message is getting through, that the numbers and the stats are getting out, that there are more younger people ending up in hospital. I think the figures yesterday was that 20% of people in Victorian hospitals are under 50, and that there was a man in his 30s and someone in their 30s in ICU in both New South Wales and Victoria from COVID. So I think that there has been a perception that it is only an older person's condition, and certainly when you look at the figures, the number of people infected, the younger they are, the higher the rate, but the impact, the older you are, the worse the impact. But that doesn't mean that young people are immune from getting sick from this. And the last thing we would want to see is a lot of young people having to live with the consequences of this long-term effect that we're seeing now. And I think it's only going to be a matter of time until we learn more and more about that long-term impact.
Professor, we've tackled this question before, but I think it's worth talking about again, about why in epidemiology we talk about deaths and infections as whole numbers and not as a percentage of the population. And how does Australia in that regard compare to other countries around the world?
Yeah, okay, so we've focused on the numbers, 480, through whatever the daily numbers are, but you can convert them into rates or percentages like that. Now, I did some calculations like this last night, and I was a bit alarmed, actually. So if you actually take the number of cases that are getting reported in Melbourne, and you pretend that Melbourne is a country, and then I went back and compared it to the UK, which had very high rates, we're now getting about the same daily rates as what the UK was at the peak. Now, admittedly, that was across the whole UK, and there were regions of the UK that had higher rates at different points in time. So if I compared Melbourne to Birmingham at the worst point, then Birmingham was probably worse. But nevertheless, to answer your question, the infection rate in Melbourne is quite high by global standards at the moment. We're no longer the lucky country when it comes to COVID. We're certainly not the lucky city in Melbourne. So that's the first thing there on the percentage infection. Now, with the deaths, we do often talk about them in percentage terms or rates. So we often use this rule of thumb, 1% of people who get the infection will die of it, and perhaps 2% of people who manifest with symptoms will die of it. But that is averaged across all ages. And as we talked about before, it actually varies enormously by age. So that 1% is very much a rule of thumb just to kick off some thinking about stuff.
Sophie, when we look at other countries, are there any standouts to you about which countries are dealing with this well and how they're emerging, particularly from their second waves, and what we here perhaps can learn from that?
Well, I mean, I think Professor Blakely might be in a better position to answer this, but from my research that I've had a look at other countries and seen how they've gone with second waves, but the majority of them are still really dealing with it and still trying to get the case numbers down. There have been some countries like, I think it was Singapore, that was doing really well and then had an outbreak in a number of cases, and they're still having cases in the hundreds of cases every day still. So I think this is something that many countries around the world are all trying to work this out in real time, and there's no manual for it, unfortunately. There's no plan on how to deal with this. So we're all in some ways all making the same mistakes at the same time. But having said that, it's so important to reinforce just how well Australia is doing compared to so many other countries in the world, even though it might seem like we've gone a little bit in a backward step with Victoria at the moment, overall we're still doing really, really well. And today the Tasmanian Premier actually announced that there's going to be a travel bubble between Tasmania, Western Australia, South Australia and the Northern Territory. And so that just shows you that we are making steps forward. We are making inroads to coming back to being able to do things like travel. And that's certainly not the case in other countries where they're still dealing with, like the United States, for example. So I think it's important to insert a little, message that despite this little setback, we are still doing really well.
Professor, the borders, I guess, in that regard, are sort of opening up somewhat, aren't they?
It was the first I heard about it, but I've been waiting for that. And it's important because it sends a message to New South Wales and particularly Victoria that you're no longer wanted as part of our club, to exaggerate a bit. It's completely sensible that the other states would say, OK, you can travel between us now. To me, it just redoubles the necessity for Victoria and New South Wales, if they lose control, to try and eliminate this community transmission so we can join that travel bubble. If we don't succeed in that and we can't get rid of the virus completely out of Victoria, then we can form some other travel buddy mates in 3 or 4 times. For example, we might become travel buddy mates with South Korea and Singapore, which have basically got the virus at very low levels and just keeping on top of it. But it is going to be challenging for Australia to go forward as a nation if we end up with 2 separate sub-nations in it. Hence, again, redoubling the effort to eliminate in Victoria and get this thing controlled in New South Wales seems sensible to me.
Sophie, a number of people ask this question, and I've heard it too, that there's this sort of speculation that the virus is becoming weaker as it evolves. Is that true?
Well, look, not from my reading of it. I mean, we know that the virus is mutating and changing because they can look at the genetics of it and then track it back as it spreads through from person to person. But I think the good news is it doesn't seem to be getting any stronger as it mutates. So I'll be interested to hear what Professor Blakely has to say. But I don't believe that there's any research out to justify that it's getting weaker, but also that it's not getting stronger. Because there was some speculation early on, and there were some papers that were put out to suggest that there was this sort of more dangerous strain of the virus, but that's now being sort of put to bed.
That's been refused. Yeah.
Which is good. That's good news. So that's good news. So I think it's remained fairly neutral as far as I can tell from the research.
Professor?
Yeah, so there's little, if no, evidence that the virus is getting worse or dramatically better. But remember, viruses will constantly mutate. They'll just keep changing. And that's why, for example, we know that the security guards were the conduit for the virus out into the northwestern suburbs of Sydney, because when you get right down to it, you can actually track them based on their genomic sequencing because they'll always have little wee mutations over time. At some point, the virus will do some big mutation, rather than drift mutation, it becomes what we call shift mutation, and it will suddenly become different. And whether that's worse or better remains to be seen, hopefully better. But of course, because the virus is so widespread around the world now, it will do those mutations in different ways and in different places and become quite heterogeneous over time, but probably tend to mutate to something that's less bad for us, but I can't guarantee that. But at this stage, the virus is pretty similar as far as its damage it does to people around the world, as best we know. But that will change over time at some point.
Another issue that's arisen this week, Sophie, is this question about whether Australia has the capacity to produce enough vaccine should one be found. What's the latest on that? What's your understanding?
Well, that was something that was raised at the press conference today with the Prime Minister, because there's been some positive vaccine news this week with the Oxford University vaccine and a couple of the Chinese vaccines publishing some of their findings to show that they have been able to get an immune response in patients. So it's still early days, but it's an important step towards the development of a vaccine. And then it raises that question that, if just say, for example, the Oxford University vaccine proves useful and effective, how are we going to make sure that we can get access to that around the world and that to every country that needs it can get access to it? So the Prime Minister said that that's something that the countries of the G20 are well aware of, and they've been discussing to make sure that, for example, the University of Queensland has signed a deal with CSL to manufacture their vaccine if it gets along every stage. But that could potentially be also used to manufacture other candidate vaccines if, for example, the Oxford University vaccine turns out to be the successful one. So I think they're building capacity into the system to make sure that we're able to get access to whichever vaccine proves effective, assuming that one does, and that's a pretty big assumption. So that's what everyone's hoping, that a vaccine will be effective. But it's a pretty big assumption given we don't have a vaccine for any other coronavirus.
Professor?
There's a lot of uncertainties in here. There's the uncertainty, will we get a vaccine, yes or no? But it's a bit more nuanced than that. We may get a vaccine that's really good, everybody takes it, and the game's over. Yay, brilliant. More likely is we get a vaccine that's, say, 60 or 70% effective, but like an influenza vaccine, and we vaccinate a population, and then there may still be some natural occurring COVID-19 infection, that sort of thing. Or we may get no vaccine, which is not what I'm wishing for, but that may be the case, in which case we're going to need to learn to live with this virus and, for example, rewinding 20 minutes in a discussion, understand the sequelae that people get, like strokes and stuff, and work out how to prevent them. That would be something we'll be doing over 2 or 3 years' time. As far as the vaccine delivery, if one's found, that will take some time to unwind, and it will have to be prioritised by country and then within countries. So, for example, thinking just of Australia, if we had a limited supply, who would we give it to? Would we give it to the essential workers, or would we give it to the people who are vulnerable, like the elderly? This stuff hasn't really been considered yet, but those are the types of discussions that we'll be having as time moves on.
All right, I tell you what, that 40 minutes has really ripped along. Sophie Scott, Professor Tony Blakely, thank you both for joining us on this live stream this week. And thank you to our viewers too, especially those who've sent in questions during the course of the past week. Really appreciate it. Great questions. Keep them coming in. We'll be doing this live stream at this same time every week. So stay in touch and we'll see you again next time.